Circle of drain. Okay, so today, chapter 17, critical care dosage calculations. We have done critical care dosage calculations somewhat already. You just didn't really realize it. So we're just going to further continue that. On page 345, it says we're going to learn to calculate milliliters per hour from milligram per minute or microgram per minute, mils per hour from milligrams per kilogram per minute. Remember, we've done milligrams per kilogram already, so we're going to do milligrams per kilogram over a certain amount of minutes, or micrograms per kilogram per minute. We're going to be able to figure out milligrams per minute and micrograms per minute based on what our fluid is infusing in mils per hour. And then we'll talk about titrating dosages and maybe talk about IV drip protocols. So critical care, as you can imagine, is very important for us in the nursing world because our patients are critical. They're on the potential brink of death in some cases, and anything that we do could mean literally life or death. So with critical care calculations, they have to be very, very precise and specific. So the doctor might order a certain amount of medication based on the patient's weight in regards to mics per minute, like we talked about. And then we're going to have to calculate those, very precise dosages and fluid rates to give our patients. So sometimes we might have to double check our orders and make sure that the doctor's ordered the correct amount of medicine. So if we know that the patient can have a certain number of milligrams for every kilogram that they weigh, and the doctor orders it, say, in mils per hour, we need to make sure that the mils per hour that the patient is getting is the proper dose for their weight. So that's basically what those different objectives were telling us how we're going to do. So the first thing on 346 is calculating milliliters per hour infusion rates from milligrams per minute and micrograms per minute dosages. Okay, so just remember, even though this sounds very confusing, if you'll focus on what you're solving for versus the information that's given to you in the problem, then you'll be good to go. Okay, so example 1 on 346. A provider orders Norpace to be infused at a rate of 0.4 milligrams per minute. The pharmacy supplies the medication in an IV bag containing 250 milligrams in 500 milliliters of D5W. Calculate the desired infusion rate in milliliters per hour rounded to the nearest tenth. So we're solving for milliliters per hour. I start with milliliters on top. So go back to your problem. What does it tell us about milliliters? We have 500 milliliters, and what's in that 500 milliliters? 250 milligrams. So I know I want to cancel out milligrams. It's going to be on top next. What does the problem tell us about milligrams? They've ordered it, the doctor ordered it to be infused at 0.4 milligrams for 1 minute. Okay, I've got milligrams canceled out. I've got milliliters on top, minutes on bottom. I want milliliters on top, hours on bottom. So now what? We put that conversion, 60 minutes over 1 hour. Now I've got minutes canceled, hours on bottom, mils on top. So my problem is set up correctly. So 500 times 0.4 times 60. What'd you say it was? 12,000? Over 250? And we got 48 milliliters per hour. Okay. So in order to infuse that fluid at the rate the doctor ordered of the milligrams per minute, we have to set the IV pump to run 48 milliliters per hour, and that will deliver that desired dosage. Okay. Example number 2. Provider orders Isoprel to be infused at a rate of 4 micrograms per minute. Pharmacy supplies the medication in an IV bag containing 1 milligram and 250 milliliters of sodium chloride. What's the desired infusion rate in mils per hour rounded to the nearest tenth? So mils per hour, start with mils on top, and we know we have 250 mils. What's contained in that 250? A milligram of medication. I want to cancel out milligrams. What does it tell us about milligrams? It doesn't, but it tells us about micrograms. So what does that mean? No. You're backwards. 1 milligram to. Okay. That got rid of milligrams. Now, what do I know about micrograms? 4 micrograms for a minute. That got rid of micrograms. Mils on top, minutes on bottom. What do I want on the bottom? Hours. Put that conversion, 60 to 1. So now I have 250 times 4 times 60, which is 60,000, times 1,000, or not times, divided by 1,000. So you should get 60 mils per hour for your final answer. They want us to round to the 10th, but it came out even, so I don't have to round at all. So in this case, we would set the IV pump to infuse 60 milliliters per hour to deliver that 4 micrograms per minute of medication. Does that sound good so far? Any questions? So the hardest those problems would get would be to throw in a conversion factor if it gave it to you in micrograms instead of milligrams and minutes instead of hours. So that's what you'll be doing with those. So the next examples are calculating milliliter per hour infusion rates from milligrams per kilogram per minute and micrograms per kilogram per minute dosages. Okay. Provider orders Solumedrol 0.05 milligrams per kilogram per minute for a patient who weighs 67 kilograms. The infusion bag contains 200 milligrams methylprednisolone in 100 milliliters of D5W. Calculate the mils per hour infusion rate and round the answer to the nearest tenth. So what am I solving for? Mils per hour again. What do I know about milliliters?
100 milliliters to 200 milligrams.
Okay, I've got 100 milliliters, and contained in that 100 milliliters is 200 milligrams of that medication. Okay, so now I'm going to use milligrams next to get that canceled out. What does it tell us about milligrams?
0.05 milligrams.
0.05 milligrams were ordered. What in relation to that 0.05 milligrams? 0.05 milligrams for every kilogram per minute. So both of those are going to be on the bottom. Got rid of milligrams. Now, what do I do with these kilograms and minutes? What do you want to do first? We want to get rid of the kilograms. Okay. And we know that the patient is 67 kilograms. What do I put over that 60 or under that 67? A 1. So that's what we've done the whole time, remember, the whole semester. Because it's just that one patient is 67 kilograms. There's usually nothing related to that. Sometimes there might be. So that gets us canceled out for kilograms. Now, minutes on top. What do I want on the bottom? Hours. So I don't have anything left in my problem that deals with minutes. I just have to convert minutes to hours. So I'll be putting that 60 to 1 conversion factor in there. That gets rid of minutes, mills on top, hour on bottom. So 100 times 0.05 times 67. 335 divided by 200. And I get 1.675. What am I supposed to round to? The nearest tenth. Sorry. There's the 10th space. Look to the right of the 10th space. What do we got? A 7. So what does my final answer become? 1.7 milliliters per hour. We got the wrong answer.
Did you multiply the 60 and then at the end?
Nope, I didn't. That's what I did. Good job. So all of that, and I got the wrong answer because I can't work a calculator. Okay, 100, that's what I have you guys for, 0.05 times 67 times 60. Now we're probably looking more better. 20,100 over 200. 100.5. It's already rounded to the 10th. So is that the right answer? Yes. Yeah, it's got that written down. Okay. Example 2 should be the exact same way. Let's look at page 350 and do some of the practice that we can't see worked out. So why don't you guys do let's do number 1. See what you can come up with. You're solving for milliliters per hour, rounded to the nearest tenth. I'll give you just a minute to get that done. Okay, so we're solving for mils per hour. So we're going to start with milliliters on top first. What do we have in milliliters? 250 milliliters. And what's in that 250? 5.85 milligrams. Okay, do we know anything about milligrams? Not in the problem. It gives us our information in micrograms. So I need a conversion of milligrams to micrograms, right? So we know that it's 1 to 1,000. That gets rid of milligrams. Now we want to get rid of micrograms. 0.125 micrograms over what? Kilograms per minute. Okay. So now what do you want to get rid of first? Kilograms or minutes? Kilograms? It's up to you, whatever you want to do. So what do I know about kilograms? The patient weighs 65. We put that over 1. Now what do we do with the minutes? We want hours to be our final answer, and we've got 1 minute here. So we convert minutes to hours, right? Hours on top, mils on bottom. Did everyone get this far? Great. So 250 times 0.125 times 65 times 60. I remembered it that time. And then I've got 5.85 times 1,000. And that comes out to be 20.83 repeating. I round the answer to the nearest tenth. That's the 10th spot. Look to the right of it. What will my final answer be rounded to? Right. 20.8 milliliters per hour. Did you guys get that? Awesome. The hardest part about these problems is making sure, trying to figure out when that conversion goes in there. And if you just keep doing it in the order that you're used to, the way we do it, hopefully it won't be too confusing. And then putting that kilogram per minute on the bottom. So if you know to put that on the bottom to finish out the rest of your problem, you'll be fine. These can go either way. You could start with the 60 minutes over an hour and then the kilograms. Doesn't matter the order you do it in, whatever makes sense to you. Okay? You guys feel okay about this? Good. Okay, next on page 351. We're going to calculate milligrams per minute and micrograms per minute dosages from milliliter per hour infusion rates. So the nurse must be able to verify that the correct dose of medicine is infusing, especially if a programmable IV pump is not being used. Usually in critical care, they'll make sure that you've got an IV pump just because it's so important for that exact dosage to be delivered to the patient. But in some cases, you never know. This can be done by gathering the following information: the mils per hour infusion rate, the amount of medication in the bag, and the original volume of fluid in the bag. And this is also helpful. So like if you come in to work on shift change and you've got your patient that's getting multiple different infusions, and you want to make sure that, that pump is set to infuse, 1 milligram or 100 milliliters per hour, but is that infusing the correct doctor's order of 1 milligram a minute, for example? So you've got to be able to do those calculations to double check yourself or the infusion that's running with the doctor's order. So this is why we're learning these methods. So your example 1, nurse walks into a patient's room, Sees an IV infusion of lidocaine infusing at a rate of 15 mils per hour. The IV bag contains 500 milligrams of lidocaine and 500 milliliters of normal saline. Calculate milligrams per minute dosage that is infusing, rounded to the nearest hundredth this time. So rounded to the nearest hundredth milligram. So what are we solving for? Milligram per minute? Milligrams over minutes. Start off with milligrams. What do we know about milligrams? There's 500 milligrams in what? 500 milliliters. I need to cancel out milliliters. What does it tell us about milliliters? It's infusing at 15 milliliters for 1 hour. Milligrams on top, hours on bottom. I want minutes on bottom. Conversion, right? That cancels out hours, milligrams on top, minutes on bottom. So my problem is set up correctly. 500 times 15. It came out to the 100th spot, so I don't have to round. So it says the nurse calculates that the infusion, which is running at 15 mils per hour, is providing the patient with lidocaine 0.25 milligrams per minute. So they're going to have to make sure that that's within the range that's been prescribed to make sure that the patient's getting what they need to be. Feel good so far? Example 2. Nurse wants to verify the microgram per minute dose of the infusion. It's running at 9.1 mils an hour. The bag has 20 milligrams in 100 milliliters. What's the mics per minute dosage? Round to the nearest tenth this time. So as you can see, you're going to have to really pay close attention to where you're supposed to round. Some you might have to round to the 10th, some to the 100th. So definitely read the directions and keep that in mind. So instead of milligrams per minute that we did last time, we're looking at micrograms per minute. Okay. Does it tell us about micrograms in the problem? No, but what does it tell us about? Milligrams? Yeah. Okay, so we need a microgram to milligram conversion. So I know that there's 1,000 micrograms to 1 milligram, right? So now, what does it tell us about milligrams? There is 20 milligrams contained in 100 milliliters. And then the doctor's order, or not doctor's order, but the infusion is running at 9.1 milliliters for 1 hour. But I need micrograms over minutes. Convert hours to minutes. Then we've got it set up correctly. 1,000 times 20 times 9.1 is 182,000 over 6,000. Right. 30.3 repeating. What are we rounding to this time? 10th? Mm-hmm. So that would be 30.3 micrograms per minute that patient is getting with the pump running at 9.1 milliliters per hour. Okay, let's do another practice one. Try number 1 on page 353. So we're solving for milligrams per minute. IV is infusing at 300 mils per hour, and the bag contains 1 milligram in 50 milliliters. Calculate milligrams per minute. So how many milligrams do I have? What?
1
milligram over?
50 milliliters.
Okay. What about milliliters?
40 milliliters per hour.
How much?
30 milliliters.
For 1 hour?
Yeah.
Then what?
And 1 hour over 60 minutes.
Then I got mils or milligrams over minutes. So you should have got 300 over 3,000. And what is that? 1/10. Okie doke. Let's look at let's do number 10. Same page. Okay. Number 10. What are we solving for? Micrograms per minute. What do you know about micrograms?
1,000 micrograms per milligram.
I have to put a conversion in because it gave it to us in milligrams. Okay. So 1,000 micrograms to 1 milligram. What do they give us about milligrams?
20 milliliters.
20 milligrams over 100 milliliters. What else about milliliters?
7.3 milliliters to 1 hour.
Micrograms on top, hours on bottom, so that means a conversion. Everyone get that far? Great. So 1,000 times 20 times 7.3 times 1 is what? And that is over 6,000? So what's your answer?
24.3.
24.3? That's correct. Okay, so the last thing in the chapter discusses titrating dosages according to patient response. So what it means to titrate a dosage means to change it based on how the patient is responding and reacting to the medicine. So if you're giving blood pressure medicine, for example, you might need to increase it or decrease it based on the patient's response and how their blood pressure responds to the medicine. So you'll have specific orders usually related to the titration of the medication. And then a lot of times the order will give it to you in a range. So you can alter the rate of the medicine between this range. So we're going to be figuring out ranges based on that. So for example, it gives you the drug dopamine can be infused to help maintain blood pressure when a person is in shock. The nurse's responsibility when infusing dopamine is to obtain frequent blood pressure readings and adjust the dose of dopamine up or down. An order for dopamine may prescribe a predetermined range within which the nurse can increase or decrease the dose. If the patient isn't responding within the dosage range, new orders must be obtained. So example 1, a provider writes an order to start a dopamine drip at 5 micrograms per kilogram per minute IV. The dopamine drip is to be titrated in 5 microgram per kilogram per minute increments up to 20 micrograms per kilogram per minute to maintain the patient's blood pressure within the range that was ordered. The patient weighs 66 kilograms and the pharmacy gives you 400 milligrams of dopamine and 250 milliliters of D5W. So what we have to do is calculate the mils per hour flow rate range for that drip and round to the nearest tenth. So the flow rate range is the beginning flow rate and the maximum flow rate. Okay, so if you look back there, it says they've ordered it to start at 5 micrograms per kilogram per minute. And then you can increase it up to 20 micrograms per kilogram per minute. So what you need to know is, what are you setting that IV pump in milliliters per hour? What is that IV pump going to run to deliver 5 micrograms per kilogram per minute of medicine? And what is the maximum it can run to give 20 micrograms per kilogram per minute? Okay. So we're looking at mils per hour. And we want to start by doing that 5 mics per kg per minute. So what do I know about milliliters that they tell us in the problem? What do I have available? I have 250 milliliter IV bags, and How much medicine is in that 250? Okay, so that's my concentration of medicine. Now, what do I know about milligrams? They give us the order in micrograms, so I'm going to have to convert milligrams to micrograms, right? And we know it is 1 to 1,000. So now I can work with that microgram, and our beginning is 5 micrograms over a kilogram per minute, right? So I've got mils on top, kilograms and minutes on bottom. So this should look familiar to you because we've been doing that all day. So now I want to get rid of the kilograms. What does the patient weigh? 66. Put that over 1. That gets rid of the kilogram. Now I need to get rid of the minute. I want my final answer to be in hours. So I put my conversion, 60 minutes to 1 hour. And that gets rid of minutes, hours on bottom, milliliters on top. Problems should be set up correctly. 250 times 1 times 5 times 66 times 60. What did you guys get? I got a really big number, but I might have hit the wrong thing. 250 times 5 times 66 times 60. So you get 4,950,000. On the bottom, we've got 400 times 1,000. Okay. So top divided by the bottom, 12.375. What are we supposed to round it to? The nearest tenth, which is? So am I done? No, because that's just the beginning rate. So now I have to find the maximum rate, okay? So 12.4 milliliters per hour is the beginning rate. So now we get to solve for the maximum flow rate. So it has the same information. What do we do about milliliters? We had 250. There's 400 milligrams in that 250. We had to put our conversion factor in here because it gave the order in micrograms, right? So what was the maximum order? 20 micrograms over kilograms per minute. Patient's weight. Got rid of kilograms, and then minutes to hours conversion to cancel that out. Okay. This is the same problem we just did, only this is the maximum order that they gave us. So we've got 250 times 20 times 66 times 60, and that's 19,800,000 divided by 400,000. And then that answer, 49.5 milliliters per hour. Okay, so that is the maximum flow rate. So if you are to give the range of milliliters per hour, it'll be 12.4 to 49.5 milliliters per hour.
You just add the, you just add in the maximum flow.
You don't have to add anything because, am I understanding you correctly?
No, you just add that into the problem after you figure out what the heating rate is.
You could. You're talking about this right here?
Mhm.
Yeah. Yeah, you can just be careful so you don't get mixed up. I would write the problem again and just know that that order is what you're going to replace, and everything else should be the same.
Okay, yeah, so that's where I got confused. I was like, why
Yeah.
did you just put that with your last because
Yeah, this changes. So with the beginning flow rate, it was 5 mics over kigs per minute. And then the max was 20. But it's the same patient and the same medicine, so everything, all the other information is going to be the same.
okay,
It's still 2 separate problems.
okay.
So your answer, when it's saying calculate the mils per hour flow rate range. So anytime your answer says calculate the range, you're going to have 2 answers. Okay? You're going to have a low and a high. So this answer would be 12.4 to 49.5 milliliters per hour. That would be the range. Okay? It is warm in here. We can let's do another example that does not give us the answer. But let's do number 3 on page 357. Okay, so number 3, provider orders procainamide IV drip to begin at 1 milligram per minute. Maximum dose is 6 milligrams per minute. The IV bag contains 1 gram of procainamide in 250 milliliters of D5W. And our directions say to calculate mils per hour flow rate range rounded to the nearest tenth. Okay? So, what do we know about milliliters from what they gave us? 250. What's contained in that 250? 1 gram. Okay. Want to get rid of grams. What do I know about grams? They gave us the order in milligrams, so I need to convert, right? So 1 gram is 1,000 milligrams. Now I can work with the milligrams. And what was that order? The first one?
1 milligram per minute.
What was it? 1 milligram per minute? Okay. Mils over minutes left. I need hours, so put that conversion of minutes to hour. Okay. So I've got 250 times 60 over 1,000. What's 250 times 60?
18,000.
18,000? 15? Over 1,000? So your answer is 15, right? So that is the lowest range. Now we need the highest range. What was our high order?
6 milligrams per minute.
Okay, 6 milligrams per minute. That was the first order. I would suggest when you're learning to do these to rewrite your problem. Okay. But for the sake of this class, we're just going to erase this. Okay, because everything else is the same. So now I've got 250 times 6 times 60. $90,000 divided by 1,000 is 90. So my range of my rate range would be 15 milliliters an hour to 90 milliliters per hour. So don't forget, if it says range, 2 answers. Otherwise, you've got one problem. You want me to work some more? You good? Okay. We can do one more. Look at number 7. We didn't work these. Vaprazole IV drip is infusing at 14 milliliters per hour. The IV bag contains 20 milligrams in 250 milliliters. The prescribed dosage range is 13.8 to 26.7 micrograms per minute. The directions say calculate the micrograms per minute dosage that's currently infusing for the IV drips and indicate whether that dosage is in the range. So with these problems, we were figuring out the range, but this time they're giving us the range, and we've got to figure out is the dosage that they're giving in this milliliter per hour range. Okay, so we're solving for what? Mics per minute. Okay. So we've got, it's infusing at 14 mils per hour. And we need the microgram per minute dose. So, given that problem on number 7, do we know anything about micrograms? Okay, so this is the confusing part. So we should be just trying to figure out how many micrograms per minute that mils per hour is. So this range we shouldn't need in our calculation for now. So what we're looking for here is the concentration of that medicine, what we have available, and what we have available, they gave it to us in milligrams per milliliter. Okay, so see that 20 milligrams in 250 milliliters. So we're going to have to convert micrograms to milligrams. Okay, so 1,000 micrograms to 1 milligram. And then 20 milligrams is a 250. Okay. Now, what was my rate that they told us? 14 mils an hour. That got rid of milliliters. I have hours on bottom, but I want minutes, so I put a conversion. So minutes on bottom, micrograms on top. So I've got 1,000 times 20 times 14, and that is 280,000. On the bottom, I've got 250 times 60. And I get 18.6666 repeating. I'm rounding to the nearest tenth. So that's 18.7 micrograms per minute. Okay, so go back to that question. We've calculated the micrograms per minute. Indicate whether the dosage is within the prescribed range. So they told us it's 13.8 to 26.7. Okay, does 18.7 fall in between 13.8 and 26.7? Yes. So yes, we are infusing that medicine within the prescribed range. Okay. The good news is you're not going to have probably, if you had any on your final, you might have one, but I doubt that there will be any like this on your final, but we still need to attempt to try to figure out how to work them out. Okay. How about do number 9 for me? So remember, Leanne, that you do not need the range. If it gives you the range, you don't need it in this instance. So you're figuring out how many micrograms per minute. Okay, so Isopro IV drip is infusing at 90 milliliters per hour. The IV bag contains 1 milligram in 250 milliliters D5W, and the prescribed dosage range is 0.5 to 5 mics per minute. Okay, so we start with micrograms, but they gave us the concentration in milligrams. So that means we convert. Now, what was the order or the concentration in milligrams? 1 in 250. Okay, then what? 90 milliliters to 1 hour. And then I need it minutes on the bottom so I convert. Okay, so minutes on bottom, micrograms on top. 1,000 times 1 times 90. So our answer is 6 micrograms per minute. Okay, our range is 0.5 to 5. 6 does not fall within that range. So it's outside of that range. Okay. Makes sense. All right. That's all we're going over this week. That leaves us one final chapter next week. Hard to believe. It seems like usually after spring break, the semester just goes by in a flash. So.